Today on West Texas View, we're learning about Botox. Now, if you're wanting to see yourself in a new light, one with less wrinkles, you should know about the procedure before you make any hasty decisions to stop the effects of time. So joining us to talk about Botox is Dr. John Bauer. He's with the Texas Tech Physicians of the Permian Basin provider. So thank you so much for being on with us.
Oh my gosh, thanks you for having me again, Caitlin.
Absolutely.
It is a pleasure.
Absolutely. So first of all, talk to us about what Botox is for.
Well, you know, the very thought of using something like Botox, which is a botulinum toxin, it seems absurd in some ways. However, it is one of the most valuable tools I have in addition to good skincare that is non-surgical that I can help patients with. So basically the situation is there are muscles in and around our face that work against us as it relates to looking concerned, or that makes us feel like we're angry or whatever, and those sorts of things. So what Botox does is it gets into the nerves between the muscles and relaxes those muscles very locally and provides a really nice decrease in that concerned look, especially between the eyes, in the forehead, and around the lateral eyes.
Okay, see, I'm here learning about it, and I'm like, cool, yeah, you know, and I'm making those, so that's funny. So how is Botox different from fillers?
That is a super important question, because so often people ask me about what is it, can I put my Botox here or there, and they don't understand that the fillers are really used to fill hollows, whereas Botox is used to relax muscles that pull on our face and change the way when we are animating.
Okay, now what is it that makes Botox so useful?
Well, it is an extremely useful tool to, as I was describing, when people are animating, they feel like they're giving a thoughtful concern, whereas when you have these muscles functioning and pulling your eyebrows in, they make you look to the person looking at you as if you're concerned or angry or unhappy. Unwinding those muscles, it makes you look a lot more comfortable, relaxed, and fresh.
Okay, now is there anyone who should not use Botox?
That is people that have neurological diseases where their nerves aren't functioning properly definitely should not. There are also people that take on a daily basis medicines that thin their blood. They should not do that. They put themselves at risk of bruising. Okay. And finally, if you have an active infection or somewhere, because I have to get the medicine into their skin, I have to pierce their skin. If you have an active infection on your skin, obviously that wouldn't be a good idea. Wow. So you get yourself healed and healthy first.
Okay. Now you were talking about getting into their skin and all of that. Does it hurt is what I want to know.
That is what a lot of people are concerned about. For the most part, tiny, tiny needles of almost just they're almost like a hair are used to deliver the medicine. So does it hurt? The answer is it hurts a little, but it's not the kind of hurt that makes you cry.
Okay. All right. And how long will these effects of Botox normally last?
Well, first thing you should know is that it takes about 3 days. So it isn't something that works instantly. So it takes about 3 days to start working. It works at full effect in about a week, and then it lasts about 4 months.
Okay, excellent information. Dr. Bauer, thank you so much.
Thank you.
Always a pleasure having you on.
A pleasure, thank you.
All right, stick with us. We'll be right back.